Hi, this is Dr. Roshini, consultant diabetologist at Vinita Hospital. Today, I'm going to talk about know your risk and know your response towards diabetes. As you all know, diabetes is of two types, type 1 and type 2. Type 1 diabetes is basically where our body does not produce enough insulin. And type 2 is basically due to the insulin resistance. Our body produces insulin, but the body is not able to respond well. So there are few factors, that is the risk factors, that can be modifiable and few are non-modifiable. For example, in the category of non-modifiable risk factor, we have our age, which cannot be changed, and then the race, ethnicity, and family history of diabetes. So modifiable risk factors are where we can change it, and through that we can prevent diabetes, that is the type 2 diabetes. So the non-modifiable we have done, and the modifiable are the sedentary lifestyle, obesity, and we do have hypertension, high cholesterol levels. Those are the things to be concentrated to prevent diabetes. So under the category of modifiable risk factors, we also have smoking and alcohol consumption, which should be avoided to prevent diabetes. We should know about ABCs of diabetes, basically A1C and the blood pressure and the cholesterol. So we should know our numbers. The target range for A1C is 7% and blood pressure less than 140/80, and LDL, that is the cholesterol, should be less than 100. Apart from this, we should also be aware the prevention of diabetes is basically possible only through lifestyle modification. So we should stay active, work out more, like at least half an hour of walking daily, and then eat healthy, increase your fiber intake and protein intake based on your other comorbidities, and reduce the sugar levels if possible. I know most of them cannot, control the amount of sugar, and probably you can just cut down on your sugars by at least taking half of whatever you're consuming. So reduce your carbohydrate intake at least to the half the level. For example, if you're going to take 3 idlis or 4 idlis, reduce it to 2. So gradually try to reduce the intake that you take. And apart from this, try to stop smoking. That prevents not only diabetes but also the exposure towards cancer. And alcohol cessation is also one of the important thing. At least reduce the content of alcohol that you're going to take, the quantity basically. Apart from this, we should also know about the target ranges. It's not only about the fasting postprandial and your HbA1c. There is also another entity called as glucose variability. So glucose variability can also lead to end organ damage, and that can lead to the complication, not immediately, but 10 years down the lane, you might end up in complications. So we have to be cautious about the glycemic variability that is happening around. So why am I talking about know your risk and know your response? It's basically World Diabetes Day is coming up on November 14th, and as you all know, almost 500 million population worldwide is affected with diabetes. And India is no wonder we're having about 77 million people affected with diabetes, and we rank the second after China. And that's not something to be happy of. It's high time that we should all take charge to make a better and happier future. We should know our risk and we should know our response and prevent diabetes. Thank you.